Hey guys, this is Q here. We got some exciting things going on at the Brain Spine Pain Institute of Lake Nona. Come on in and let's check it out. So, when you guys first arrive, here's our wonderful waiting room. You'll be greeted by smiling faces, like you just saw. After you wait and you have intake forms filled out, we typically like to check vitals and ensure that everything is stable prior to you seeing your physician. This facility floats from a medical side to a physical therapy side. We'll talk about that briefly here in a moment, but we're moving on through the medical side here. We have multiple exam rooms. You'll typically work with one of the physicians here. You see that we have different testing devices. One of the cool ones that we have here is the right eye. The right eye helps individuals who may have visual deficits following the motor vehicle accident find those objective data needed to work on a treatment plan. And then it can also be used to provide some intervention as well to assist with those ocular issues that may be present. Also, really comfortable exam chairs as well. So as you know, when you're here, you won't be uncomfortable. Next, we have our audiology room, or our second exam room. Again, as we think about the entire person, we know that with certain injuries following motor vehicle accident, there may be issues with hearing. And so we have a room designated to assist with examining and finding out data associated with that. Again, spacious and colorful, just to make sure that while you're with us here, it's an enjoyable time. So really special about this room here, or this hallway rather, we have our nurses station right now. We have exciting things going on in regards to research, but we're not going to say too much about that because, again, it's research and we want to keep some things under wraps. But one of the things I can show you is our exam room 3. Here, we have a really special piece of equipment called magnetic e-resonance therapy, or MERT. MERT uses a magnetic stimulus placed in different areas of the head to treat certain disorders and conditions such as anxiety, depression, post-traumatic stress disorder, and then also autism as well. And so we use this device as an adjunctive therapy along with the other things we do medically and on the physical therapy side here. We'll keep it moving, guys. Another exam room, and this room is not set up, but we typically do what are called qualitative electrical encephalography, or EEGs is what you might know. We do that because we want data to associate with the magnetic e-resonance therapy to have a specific program for you, so it's all protocoled. Next, we have different imaging devices. So this one right now is out on the side, typically it's in the room. This is our X-ray device here, and if you come in, we also have a C-arm or a CT scan arm as well to assist with those imaging needs that you might need, as well as imaging associated with procedures that may need to happen in-house, because there are some procedures that are able to be done here in-house with the assistance of that imaging. And as we progress through, we'll come over to our recovery room. I'll let you guys go in first to get a sneak peek. So we have an in-house lab that you just passed there. And then we have multiple recovery suites that can be private with curtains, and then seating areas for any individual who may be waiting with you, as well as multiple vital monitors as we're monitoring your recovery to ensure that you're stabilized prior to you being released. And again, here's our lab. Have a refrigerator, some centrifuges, things just to collect specimens needed for testing. Our break room, you guys don't need to see too much of that, but a really cool thing that I think goes what we have to show you guys is this beautiful mural here. It really stands what we're trying to do here at Brain Spine Pain Institute of Lake Nona. And so just a sneak peek of what we're all about here. Outstanding. And now here's the part you guys may have noticed. I'm talking kind of lightly on this side, but here's the part that I know a lot about. This is the physical therapy. Come on in. So on this side, we have multiple individualized treatment rooms if there are conditions that maybe you're not able to tolerate being amongst multiple people, or maybe it's a little bit more private. We have areas that we can provide that customized private treatment for you. You'll see as we're panning out, we got my colleague, Dr. Matthew over there. Great smile, not forced at all. And here we also have, as you're scanning up, overhead safety support system. So when we're working on those balance activities, you can feel rest assured that not only will you have a physical therapist who's skilled right next to you, but you'll also have a device that can hold up to 300 pounds to make sure that if you have those near falls or falls, you're not going to hit the ground. Some of these things you guys have already seen. We got the David machines over here to help with spinal strengthening and improve range of motion in our spine. So our neck, our back, our thoracic area. Some of the things are more traditional physical therapy tools. So treadmills and bicycles, things that are really going to help get heart rate up and then also assist with recovery as well. They're just as important, even though they're not as spectacular looking, they are just as important as some of these other things that we have here. We've mentioned before in some of our other videos, the Virtualis system. You guys, please, I'm gonna jump into the picture. Check out our Virtualis video. It will tell you so much more. You guys, hopefully we can have the link in the video here. Afterwards, keep it moving. That's the Virtualis Motion VR. And now another one that I want to plug here, another video, is going to be the HydroWorks pool. This particular piece of equipment typically is in college universities, beginning of my career in the VA system. And so they had them in the VA. Rarely will you see this in a private sector clinic like ours. And you won't see anything else like this in Central Florida, other than maybe one other place. And it's not an above ground pool like this, nor is it heated. We're probably one of the few that have a heated above ground pool that has treadmill, it has water jets. So as you're here, if you have difficulty with moving, walking, standing, we can get you back to doing the thing you want to do in a buoyant, warm area, an environment that can make it tolerable for you, and then also fun, because who doesn't want to spend a day at the pool? You can here while you're doing rehab. Oh yeah, I almost forgot. This is our SmartFit device. How I think all of us describe it. Imagine, if you will, if you guys don't know, you're probably not a millennial or above. You might be like one of those Gen Zers, but whack-a-mole. So this is like whack-a-mole. You can use your fists, you can use other things to hit different or lit targets using your eyes, using your hands. So remember, we talked about we do some visual exams and visual interventions. Well, now this is the functional part that we can actually have you use your eyes and reach and touch and be more dynamic to get back to doing those things that you want to do, okay? Again, guys, thank you so much for coming in to the Brain Spine Pain Institute of Lake Nona. I hope you guys are interested and curious about what you've seen. We're curious about what's going on with you following an accident. We really want to serve you. So we look forward to seeing you. Take care, guys.